Well, let's bring in, speaking of athletics, sports medicine doctor, our good friend, Dr. Joe Congini with us here at 93.5, 1590 WAKR with Akron Children's Hospital Sports Medicine Center. Joe, what do you have for us today?
Hey, Ray, how are you guys doing today?
Very good. We missed you last week.
Yeah, I'm glad to be back on board. We're having a beautiful fall to follow, a beautiful summer, and we've gotten a lot further along here, and we're now getting midway into high school sports, and so everything is moving in a positive direction. It's day by day. I know it's an unusual year, but when it comes to NFL football, there's a lot of excitement around Cleveland, and a lot of questions of me about the superstar running back that we have, Nick Chubb, and his injury, and a couple of learning points from the Nick Chubb injury that I just wanted to bring out. One thing that really is irritating or aggravating to people that are that work with athletes, orthopedic doctors and sports medicine doctors, is that basically we're just MRI writing machines. So that basically anytime somebody gets hurt with a shoulder or a knee or anything like that, it's always going to be the MRIs on Monday, and that tells the whole story. And the fact of the matter is, if you are around sports medicine centers and orthopedic clinics, 90%, 9 out of 10 or so of knee injuries that are evaluated do not come in and immediately get an MRI. So let's just be very clear that, first of all, professional athletes are a little bit different in the questions that we have to answer and how quickly we have to answer those. But there's really three things that we look at on an evaluation of, for instance, and particularly a knee injury of an athlete that would come in. Number one is called the mechanism of how the injury happens. And so we got a really good look at Nick Chubb's injury. Sometimes we do with all the cameras now in the professional sports. And the type of knee injury that he had is known in sports circle as getting rolled up on. And it's very common in the sport of football. We see it in other sports too. But basically, he wasn't looking at all. He's hit from behind. This happens a lot within the line of scrimmage, is two people will be engaging each other and blocking, trying to get off a block, and you'll get hit by somebody else who rolls up the leg, we call it. And one of the things is, when you get rolled up on, the number one injury to occur is the one that happened to him, is an MCL, a medial collateral ligament injury. It's a big, thick ligament on the inside of the knee, and when that ligament gets stretched or torn, it doesn't usually need surgery, but it needs some period of time of healing and rehabilitation. And so you'd say, gosh, if getting rolled up on is very common in sports and particularly football, can we prevent it? And if you see all those offensive linemen that wear braces that are hinged on both sides, the inside and the outside of the knee, that's exactly the biggest injury that those braces prevent, is when you get rolled up on, it will prevent the MCL type injury. And so many linemen from high school through college and pros wear that brace. The problem is with hinges on both sides, Ray, it's very bulky. Yeah. So wide receivers don't like wearing them. Backs don't like wearing them. Sometimes if they're just coming back from an MCL, they'll wear it for a couple of weeks. But on a regular basis, you're not going to see skill position, speed position people wearing a brace. But they're trying to prevent that rolled up on, getting rolled, it's called rolled up on injury, and that's the mechanism. The mechanism that we've talked a lot about here of plant, twist, pop, that's an ACL. The mechanism of twisting the knee and feeling a pop on top of the knee is the mechanism of dislocating the kneecap, which is very common in young athletes. So, number one in the triad of things that we try to make a diagnosis on is the mechanism of how did it happen. Number two is our clinical exam. And so many people just, oh my gosh, do we really have to even check? No, with our hands and with examination, we can tell a lot about the knee. So we look at the range of motion and the strength, and we have stability tests to test all those important ligaments and the cartilage known as the meniscus cartilage, so that we get a better idea of what kind of injury it is. And there's a 10 or 15-minute examination that we do that helps us get a better idea of what type of injury it is. And the third part then is imaging. And imaging in a typical office may be an X-ray to start with. We do not, like I said, go to an MRI in the vast majority of cases. Probably 9 out of 10 minimum, maybe more. We don't go right off to an MRI. We use the mechanism of how it happened. We use the examination with our hands and the questions that we ask, and then maybe just starting with a plain film X-ray to get an idea of where people are at, to make the majority of diagnosis. It's not the world of just come in on Monday morning and everybody gets an MRI. An MRI, very expensive test, only going to be it's only going to be approved if it's something that's going to make a big difference in how we're going to treat patients. So all of my colleagues in the sports medicine and orthopedic world want to make that very clear. It really bothers them when somebody just comes at 9 o'clock on Monday and says, well, get me my MRI right now, because that's not the way it works in sports medicine.
Very well said. Joe, good having you back, my friend, and we'll reconnect back with you next Wednesday with more information, but great stuff today. Thanks a lot, my friend.
Let's hope sports keeps rolling along. Thanks, Ray. Have a great fall.
You too, my friend. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. He joins us Wednesdays here on the Ray Horner Morning Show.